Hello everyone, I'm Ashray Narudran and I'm a researcher in the Stanford Department of Emergency Medicine. Joining me is Dr. Rajiv, an emergency physician at Stanford.
Hello, we all know that the COVID-19 pandemic has exacerbated intimate partner violence. Today, we are here to talk about the specific ways that some people use COVID-19 to further isolate, control, and harm their partners. This may be a difficult conversation, so please bear that in mind as we go and take breaks as you need.
Given the sensitive nature of this topic, we recommend using the following additional safety steps if you might be at risk for intimate partner violence. 1. Find a safe and private space to listen. 2. Please use headphones to listen to this video. And 3. Pull up another website on the latest news or some random web page so that you can easily change tabs if anyone approaches you during this video viewing.
Also, please remember that your internet history can be monitored, so please clear your browser history after viewing this video, and also clear your YouTube history. In the show notes below, there is a link to instructions on how to clear your browser history and YouTube history, and a link to a news website to escape to if needed.
Let's have a quick chat before we move forward about some important disclaimers. While we will talk a lot about COVID, this video series should not be used for personal medical advice. If you're worried about your own health, please talk to your doctor, who knows you and your medical needs best.
Our aim will be to make you aware of these, but once again, you should talk to a lawyer if you have any legal concerns of your own.
Thank you for that. Let's get started. Unfortunately, a lot of us have heard about the rise in intimate partner violence and domestic violence during COVID-19.
In this video, we'll go over some of the ways that people who cause harm can use COVID-19 as a tool of abuse. We hope that this video will help everyone think about the specific ways COVID-19 has impacted forms of abuse, and that this will help enable and empower people to get the help they need.
COVID is scary. It makes sense to worry that the people we care about might get sick and for them to worry about us. And COVID comes with all these new decisions we've never had to think about before. Is it safe to go to the grocery store? Is it safe to visit my mother? Unfortunately, some people may use these uncertainties and fears as a way to control their partner.
Intimate partner violence is when a partner, a boyfriend, a girlfriend, a spouse, uses different actions to exert power and control over another person. In the COVID-19 pandemic, we are seeing people use the pandemic and stay-at-home orders as an excuse to control where their partners go and who they have contact with. When people control their partner's movement like this, people can feel trapped at home with little ability to escape or even reach out for help.
Before the pandemic, survivors may have had moments away from their partners when they leave for work or errands, or otherwise use their time with other people and potentially even access help and resources. Those moments were few or completely gone during the pandemic.
Inside the house, things changed too. Those who cause harm were now at home most of the time and could more easily control access to devices used to connect with friends and family, such as phones and computers. Without these options for outside contact, survivors felt more isolated and trapped than ever. As a solution at the beginning of the pandemic, when stay-at-home orders started, some domestic violence service providers advised survivors to set a regular routine. For example, that might mean taking a brief walk every day at 1 p.m. This would create a daily moment of relief in their lockdown routine without their partner becoming suspicious. This can also be an opportunity for a domestic violence service provider or other supporters to even meet with the survivor on her walks to provide cash, phone numbers for help, and emotional support.
Oh, that sounds like a good plan. In addition to controlling their partner's movements, those who harm may be manipulating their partner's fear of contracting COVID-19 as another way to coerce and control them. For example, people may limit their partner's access to masks and cleaning supplies.
Sometimes people who cause harm have refused their partners, who are essential workers, access to their children or even the house.
When partners refused to let survivors go to work when they wanted to, they were using COVID-19 risk as a way to not only control their partner's movements, but also to control the survivor's financial resources and independence. This is another means of increasing the survivor's financial and overall dependence on their partner, which gives the partner more power over the survivor. Another way that people use fear of COVID-19 to manipulate and control their partners is by restricting their partner's healthcare access. Even before the pandemic, some people did not allow their partners to go to the doctor or receive medical care, unaccompanied or at all. Some people who harm even restricted access to prescriptions.
Given the additional anxiety and fear of contracting COVID-19, this is an especially difficult situation for survivors whose partners control their ability to seek medical care.
When the pandemic and lockdown started, some doctors' offices closed. Non-emergency clinic visits were rescheduled and moved to online or telehealth appointments. Unreliable internet connections or cellular service and the possibility of partners who abuse being nearby during the conversation can make telehealth visits challenging.
So even when survivors do get an appointment with their physician, the pandemic has made it even more difficult for healthcare providers to screen patients for intimate partner violence and for survivors to disclose abuse. This may continue to be a challenge as telehealth is becoming a more routine part of healthcare.
Unfortunately, many people who cause harm have been using COVID-19 as a tool of abuse, but the pandemic has made it even more difficult to report abuse and seek help. Survivors are stuck at home with the person causing harm, with few moments alone to reach out for help. In some places, intimate partner violence hotline calls have dropped by almost 50%.
Even when a survivor tries to report abuse, it may have been confusing about which domestic violence services were open or available as we went through the pandemic. Some police stations offered online reporting, while others required in-person visits. Court operation hours and court procedures for domestic violence cases were also impacted, including affecting the issue and renewal of restraining orders. As the pandemic winds down, in some parts of the world, things are starting to open back up in person, and resources are becoming more readily accessible.
Yeah, I can see how the pandemic has worsened and created new forms of abuse and also made it more difficult for survivors to reach out for help. It's important that we take a moment to emphasize that any type of abuse or violence is not the fault of those experiencing it.
Yes, definitely. We are only here to help provide information so that more people can be aware of COVID-specific forms of abuse. Our hope is that this will help survivors and their loved ones stay aware and make informed decisions. With that said, let's wrap up quickly, reviewing what we've talked about in this video.
We learned about different ways COVID-19 has impacted forms of abuse, such as when a person controls their partner's movements by blaming COVID-19, when a person manipulates their fear of getting COVID-19 by limiting their access to masks and sanitizer, or when a person restricts their ability to work again using COVID-19 as a factor and restricts their partner's access to help seeking or health care.
It is important to recognize these behaviors as abusive and try to safely seek help when possible. If you or someone you know is experiencing this type of partner abuse, please try to safely seek support and help. If you are in the United States, you can call the National Domestic Violence Hotline or other local sources of support when you are in a safe space alone. If you are outside of the United States, please seek out your local domestic violence service agency or social support services when you are in a safe place.
We hope that this information has been helpful. We acknowledge that this can be a difficult topic to talk about, so we thank you so much for taking the time to learn with us.